Hello to everyone. It's July 23rd and I welcome you to the WHO press briefing on global health issues. My name is Tariq, and as always we will start by introducing our speakers here in the room. We have a number of WHO experts who will answer your questions. We also have a couple of our colleagues online that I will introduce a little bit later. So with us, as always, we have our Director General, Dr. Tedros. Also with us is Dr. Ghebreyesus, who is Executive Director of Health Emergencies Program. Dr. Jeremy Farrar is also with us. He's Assistant Director General for Health Promotion and Disease Prevention and Control. Next to me is Mr. Raul Thomas. He's our Assistant Director General for Business Operations and Compliance. Dr. Abdirahman Mahamoud is Director for Health Emergency Alert and Response Operation. He's also here. In the room is also Dr. Nedret Emiroglu, Head of the Secretariat for the Intergovernmental Working Group on the WHO Pandemic Agreement. And we have Dr. Maria Van Kerkhove, Director at Interim for Epidemic and Pandemic Management. Also with us is Mr. Stephen Solomon, Principal Legal Officer, and Mr. Nabil Tabal, who is Incident Manager with the Health Emergency Program. So with this, I'll give the floor to Dr. Tedros for his opening remarks.
Thank you, Tariq. Good morning, good afternoon, and good evening. The 2.1 million people trapped in the war zone that is Gaza are facing yet another killer on top of bombs and bullets, starvation. We're now witnessing a deadly surge in malnutrition-related deaths. Since July 17th, severe acute malnutrition centers are full without sufficient supplies for emergency feeding. In 2025, WHO has documented 21 deaths related to malnutrition of children under 5 years old. Rates of global acute malnutrition exceed 10%, and over 20% of pregnant and breastfeeding women that have been screened are malnourished, often severely. The hunger crisis is being accelerated by the collapse of aid pipelines and restrictions on access. 95% of households in Gaza face severe water shortages, with daily access far below the minimum needed for drinking, cooking, and hygiene. The UN and humanitarian partners were unable to deliver any food to the Gaza Strip for nearly 80 consecutive days from early March to mid-May 2025 due to a complete blockade on humanitarian and commercial access. Since then, food deliveries have resumed intermittently but remain far below what's needed for the survival of the population. Parents tell us their children cry themselves to sleep from hunger. Food distribution sites have become places of violence. From the 27th May to the 21st of July, health authorities report 1,026 people have been killed in Gaza while trying to get food from these sites. Nearly 90% of the land in Gaza is now under evacuation orders within Israeli militarized zones. Hospitals, which are supposed to be safe havens, have regularly been attacked, and many are no longer functioning. Even those that are functioning are only operating at minimal capacity due to repeated attacks, shortages of fuel and medical supplies, and constrained access. On Monday, WHO personnel came under fire in the city of Deir al-Balah. The WHO staff residence was attacked, endangering personnel and their families, including children. Israeli military entered the premises, forcing women and children to evacuate on foot amid active conflict. Male personnel and family members were handcuffed, stripped, and interrogated. One colleague remains in detention. we call for his immediate release. 32 people, including women and children, were evacuated to a WHO office bordering the conflict zone. Our main warehouse, containing vital medicines and supplies, was also severely damaged. At the UN's lead health agency, WHO's operational presence in Gaza is further compromised, crippling efforts to sustain a collapsing health system and pushing survival further out of reach for more than 2 million people. Despite this, WHO and other UN agencies are staying in Gaza, and our commitment is firm. UN agencies must be protected while operating in conflict zones. WHO calls for the active protection of UN personnel and facilities, civilians and healthcare for the unimpeded flow of aid. Once again, we call for unconditional release of the hostages. The situation in Syria is also extremely troubling. Access to Al-Sweida remains severely constrained, further hampering the delivery of life-saving assistance. The main hospital is overwhelmed, facing critical shortages of staff, electricity, and supplies. We're following events closely and are working to verify reports of attacks on healthcare, including attacks on health workers, patients, ambulances, and health facilities. Healthcare must never be a target. Health should always be protected, and safe, sustained humanitarian access in Gaza, Syria, and all humanitarian situations is critical. Now, I want to say a few words about the recent claims that have been made regarding WHO, the amendments to the international health regulations, and the pandemic agreement. Let me be crystal clear. First, the IHR, its amendments, and the pandemic agreement, all of them were proposed, negotiated, and adopted by our member states. That's how WHO works. It belongs to the countries, to all 194 member states. Second, WHO has no authority to tell countries what to do. We cannot impose travel bans, lockdowns, vaccine mandates, or any other type of measure, nor do we seek to. That's clearly laid out in our founding document, the WHO Constitution. Our job is to provide evidence-based recommendations and guidelines and to support countries to protect and improve the health of their populations. But how or whether countries implement that advice has always been and always will be up to them, based on their national guidelines and rules. That's true for everything we do, whether it's guidelines for stopping smoking, better nutrition, or preventing and addressing disease, everything we do. This principle applies equally to international health regulations, and in fact, the new pandemic agreement even has a specific section clearly spelling that out, Article 22. And third, we have a very clear, comprehensive framework in place to guard against undue influence of pharmaceutical manufacturers and other private sector entities. Of course, we work with them, as we should, but we have very clear safeguards in place that were developed with our member states. And now a quick update on the pandemic agreement and specifically the Intergovernmental Working Group. This working group, made up of our member states, was established by the World Health Assembly and tasked with negotiating the Annex for Pathogen Access and Benefits Sharing, among other things, to help the world respond more effectively to future health threats. The working group will meet throughout the year. with the aim of bringing the completed annex to the next World Health Assembly in May 2026. The pandemic agreement, negotiated over 3 years by our member states, builds on the lessons of COVID-19 to improve cooperation and coordination for a safer world for all. Now, moving from future threats to current ones. WHO and UNICEF's recent annual report on estimates of national immunization coverage around the world show both progress and pressing challenges. While there has been modest growth in vaccine coverage globally, an estimated 14.3 million children never received a single dose of any vaccine, and millions more received only partial coverage. Not surprisingly, children living in one of the more than 24 countries affected by conflict or humanitarian emergencies are at particularly high risk of missing out on life-saving immunizations. For measles, one of the world's most infectious pathogens, while global coverage is up slightly from last year, nonetheless, more than 30 million children did not receive the full course of vaccines they needed. In 2024, 60 countries experienced significant measles outbreaks, nearly double the number in 2022. While lack of access is one major problem for vaccines, vaccine hesitancy is also a widespread concern for some. WHO and other public health organizations have detailed information available on our website to help families understand vaccines which have saved millions of lives since the development of the smallpox vaccine over 200 years ago. On that note, I'm happy to share some news about another revolutionary innovation. Last week, WHO launched a new guideline on the use of lenacapavir, a breakthrough prevention medicine that can help turn the tide on HIV. HIV protection from injectable lenacapavir lasts for 6 months and prevents more than 96% of new infections. WHO and partners are working with 9 early adopter countries so that up to 2 million people will be able to access lenacapavir at a negotiated lower price. 6 generic manufacturers are in the process of developing lenacapavir, and by 2027, generic versions will become more widely available. WHO is working with the early adopter countries and global partners to make the use of lenacapavir a reality, including through guidelines and the pre-qualification process. And some more good news on global efforts at disease elimination. WHO is proud to have certified Suriname as malaria-free. That makes 47 countries and territories to have received certification, with more on the way. We have also recently validated the elimination of trachoma as a public health problem in both Burundi and Senegal, bringing the total number of countries that have eliminated at least one neglected tropical disease to 57. Tariq, back to you.
Thank you very much, Dr. Tedros. And before we open the floor for questions, I'll introduce some other WHO colleagues who are online who will be ready to take those questions. We have with us Dr. Rick Pieperkorn, WHO representative for the occupied Palestinian territory, Dr. Meg Doherty, who is a Director of Science for Health. We have also Dr. Caius Ikejezie, who is Technical Lead for Cholera. Dr. Wenjing Zhang, Head of WHO Global Influenza Program, is also with us. And also we have Dr. Naor Ben-Zaev, Unit Head for Immunization Analysis and Insights. With this, I will start with the first question. And those who want to ask questions, please click on raise hand icon and please introduce yourself. I will start with Jen Rigby from Reuters. Jen.
Hello, thank you for taking the question. I wanted to ask about malnutrition in Gaza. The DG mentioned that there aren't sufficient supplies. I wondered if you could give us more details about what level supplies are at in terms of emergency feeding for children and adults in Gaza, and any more on the situation in terms of how many acute malnutrition treatment centres are still functioning or open would be helpful too. Thank you.
Thank you very much, Jan. Maybe we can start with Dr. Rick Pieperkorn, who is online.
Thank you. Can you hear me?
Yes, we can hear you.
Okay, first of all, I'll say something about the massive amount of, and I think the DG said it very clear, how critical starvation and malnutrition have become. And our figures, I just want to stress that, is underreported. So when we see, you look at, for example, the number of under fives with malnutrition since October 23, we count over 70,000. But when you look at the number of under five, actually in 2025 is close to 30,000. Number of children who reportedly died linked to malnutrition in 2025 only is 17. Now this is underreported, the tip of the iceberg. And just when I was in Gaza myself, 2.5, 3 weeks ago, and before that, I come there every other month. We went to in the former visits, we went to the so-called malnutrition treatment centers in the north of Gaza. That one was in Kamalat 1. Kamalat 1 is non-functional anymore as hospital. It was a center supported by WHO and UNICEF. Even then, I'm talking about, that visit was actually so the former 2 months ago, more than 2 months ago. We had a lack of nutrition supplements and UNICEF had a lack of their supplies as well, both for the outpatients department and as well for the inpatients. Already there, we reported about specific cases, and even as a medical doctor myself, you could see a girl which you thought she was 2 or something like that on the acute malnourished, on the acute severely malnourished. She was actually 2 years old. Now, WHO, I mean, we raised alarm then about not getting the right supplies in, and it was in the time that no supplies came in at all. I just also want to warn everyone, we went through this cycle before. In January, February 2025, we had the same. The entry of aid was severely squeezed and limited. And we very quickly saw that there was no food diversity at the market as well. And quickly malnutrition picked up among children. Before this crisis exploded in October 2023, there was no malnutrition in Gaza. You talked about 0.6% among under fives. There was no malnutrition about pregnant and lactating women. A huge problem now. What we get now from the hospitals, they don't only see malnutrition in under fives and children, etc., but also elderly, for example. The combination is described by the DG by deplorable water and sanitary conditions, and less than 5 to 10% access to clean water, a lot of diarrheal diseases, respiratory infections, etc. It's all of course a combination that's leading even increasing this disaster. Now, last point is as well, we have seen the IPC reports and we reported on that. We knew this was happening. The world knows that this is happening and is going on. The DG also referred to the enormous amount of death, more than close to 800 deaths, and many hundreds of injured people we see around the so-called safe, non-UN food distribution sites, but including to the very limited UN trucks, these mass casualty incidents. When I was there 2.5 weeks ago, I saw both the Shifa Hospital and Nasser Medical Complex, just the same as in the first 6 months of this crisis, this horrific crisis, these hospitals were turned into one massive trauma ward. Besides that, they only had to focus on trauma patients, mainly young boys and men shot in the head, the neck, the abdomen, the chest, the knees, etc. Horrific scenes. There's a way to stop this. The markets need to be flooded by food. You will stop the mass casualty incidents, the prices will go down, and people will have access to food. There should be diverse food. At the moment, both WHO as UNICEF, we are struggling with the right supplies to assist those few nutrition rehabilitation centers which are still there. There's only 2 in the south, in Nasser and in Al-Aqsa, and I think 1 in the north, in Patient Friendly and Shifa. They try to do this as well. So flooding the markets with food is the only way forward. Over to you.
Thank you very much, Dr. Pieperkorn, for providing this information. We will go to next question. It's Yuri Aprilev from RIA Novosti. Yuri, please go ahead.
Yes, thank you, Tariq, and thank you for the briefing. My question is about Syria. We saw on Friday, especially, a lot of videos that seems have been filmed in a hospital in Sueda, where we see a lot of people who died. Obviously, they were filmed by combatant, people with weapons that were screaming in the hospital and were laughing at the bodies. So I just wanted to know if you saw this kind of videos and if you are trying to analyze it, if you know if their authenticity is real, and if you have an idea of the number of people who died there, because the difference between the official figures that are published by the government and the figures that are published by the opposition, even if it is not in the country, are totally different. So just to know if you have an idea on that. Thanks.
Thank you very much, Yuri. Maybe I will ask Dr. Ghebreyesus to start, and maybe other colleagues can complement.
Yeah, thank you very much. The reports coming out of Syria are very disturbing. We've had them as well and seen those images. Our colleagues are in the process at the moment of verifying these reports and getting the details. As you know, we have a very robust process to confirm attacks on healthcare, and that process is ongoing, so we should have details over the next few days. But it gives me an opportunity again to reiterate what we say all the time. You know, we have to protect healthcare all the time. It's not just saying that healthcare is not a target, but we have to actually protect healthcare even in conflict areas. And that's really the priority, should be the priority. We've seen several healthcare facilities in Syria attacked. We already are struggling to keep up with providing care to citizens across Al-Shuaida. So the key thing now is to verify these ones and to emphasize the messages that we've been given over the past few years. And wherever there's a conflict, especially in Syria at the moment, to prioritize the protection of healthcare in Syria and in other conflicts around the world.
Thank you very much, Dr. Ghebreyesus. We will turn to our next question, and we have Nina Larsen from AFP. Nina.
Yes, thank you for taking the question. I wanted to go back to the hunger crisis in Gaza. There were more than 100 organizations today who put out a statement warning of mass starvation in Gaza. Would you agree with that assessment that there's mass starvation? And also, when it comes to, I mean, I know there hasn't been an official famine declaration, and that's perhaps because of lacking access to the necessary data to declare that. But do you think that it would be appropriate to declare a famine soon? And finally, I just wanted to clarify on the number of children who have died. You mentioned the number since the start of the year from malnutrition at 21, But we have a doctor, or had the director of Shifa Hospital talking about 21 there in just 72 hours. So it would seem that that would be quite underestimate of that number. So if you could sort of explain how you're looking at that, and also the malnutrition percentage. Thank you.
Thank you. So maybe we can start with Dr. Pieperkorn, and then maybe Mr. Nabil can Tabal complement from here. Dr. Pieperkorn?
Yes, thank you very much. So first of all, about, can we call it mass starvation, etc. I think we have to be careful when we use that kind of terminology, so I don't want to use it. What I can say, and even coming there every other month and being there a couple of weeks ago, and what I hear now as well from I'm constantly in contact with my team and the staff, that also among the general population, there is an absolute lethargy. People cannot do whatever they do, their work. I mean, we've seen the reports from journalists that they cannot do their work anymore. The small amount of schooling, what's going on, health workers, etc. So everyone is looking for food, and for some diverse food, and specifically then, of course, for the children and the other ones. So this is, I think, it's a completely, I think it's all over Gaza, and you even see it with our own staff. So we kind of minimize, what you could say, is the UN better prepared? For our own staff, we minimize, we struggle, we had struggled with an access to water, we had struggled with the access to food, etc. And also I want to stress, I didn't mention this when you asked about medication. So our main warehouse was attacked, and it is actually destroyed. We see it as, and I think we've reported about it, and this was actually fortunately we have 3 warehouses. This was by far the largest warehouse with substantial amount of medical supplies in all areas, in trauma, in antibiotics, in anesthesia, well, you name it, etc. And we were very careful to distribute it as prioritized and constantly reprioritize that as well, because too little comes in. So it's a major blow to the already struggling health sector on its knees, but also for WHO. But as Dr. Tedros rightly said, we are here to stay and deliver. We actually have plans to expand. We're looking at other warehouses, etc. We will make sure that happens. Going back to malnutrition. So in July alone, you talked about more than 5,000 children, 5,100 children have been admitted in this so-called malnutrition programs, the CHAM programs, including 880 children with severe acute malnutrition. And I already said that the number of children with acute malnutrition under 5 in 2025 is close to 30,000. Those figures, I mean, they speak for themselves. We have reported that 21 children under 5 have died. The 21 children died in 2025. Now, I just want to stress, these numbers are most likely, we talk about underreporting. We have difficulties, of course, getting all this data, etc. So we have to go. In our destroyed warehouse, there were also some food supplies. I mean, and focusing a few supplies left for those so-called malnutrition wards, etc. So we will try to get them in and other supplies as quickly as possible. But for the real thing, of course, it's insane that we are in the same cycle again and again, that constantly there's a squeeze, there's a little release, there's a squeeze again on whatever form of aid, and specifically on food. So not just for food, the markets need to be flooded. I also want to speak up for wash and water. Of course, medical supplies, WHO has to be able to bring in a regular supply of medical supplies and essential medicines. And underpinning this all, we cannot raise this enough, is fuel. There's a lack of fuel. Without fuel, everything stops. hospital operations stopped, health facility operations, so ICU stopped, etc., etc., and the same for WASH. So I want to make a plea, and the last plea, even if we are still in a war and active hostilities as we are now, with even a WHO guest house under attack, humanitarians need to be able to operate. There needs to be a creation of humanitarian corridors. We need to be able to move around Gaza wherever there's a need. That's currently not happening. Last but not least, but that's almost like a broken record. Of course, a ceasefire is long overdue. Over to you.
Thank you, Dr. Pieperkorn. Mr. Tabal, would you like to add something?
Yeah, thank you. Thank you for the question. And just to also reiterate what Dr. Peppercorn said, so also regarding famine and declaration of famine, so there is, as you know, the IPC process and the FRC, the Famine Review Committee, is usually triggered to look into that. There are 3 criteria around food insecurity, around malnutrition, and excess mortality. And those are areas where, of course, as you know, we have been faced with challenges regarding data, regarding access to information, and really base this on robust data. But this is also a work in progress. But we've been looking at trends in terms of global acute malnutrition, also in supporting in terms of recording mortality, indirect mortality, for example. And so this has been an ongoing process. However, we have been witnessing, of course, as Dr. Peppercorn mentioned, challenges with supplies. Now we are faced with, for example, we are also faced to stop blanket supplementary feeding program, and this is due to lack of supplies, as mentioned. In the latest IPC report and the one before last year, they have been really warning about risk of famine. However, the ceasefire has really helped in reversing a lot of the challenges that and the conditions that were conducive to famine. But now we're really faced with. I think this is the most challenging situation that we've been put into, especially that the humanitarian space has been, we have been operating in a constrained humanitarian space, but now we've been really, our ability to operate has been completely compromised, and we have been supporting the health system and really preventing it from collapsing, but now our ability to continue support that is also being put at risk. Over.
Thank you, Mr. Tabal. We will go to the next question. We have Kerry Cullinan from Health Policy Watch. Kerry?
Thank you, Tariq. I wondered whether you could give more information about the WHO staff member who's been detained, because the inference has been that the WHO is somehow working with Hamas. So maybe, if not his name, his position, whether you know where he's being held, and whether you've had any direct contact with the Israeli authorities to secure his release. Thank you.
Thank you. Dr. Peppercorn, do you think we can share any details?
No, I think I also don't understand the question very well, but let me try to answer the question. So first of all, talking about the national staff and the caretaker from our office. So the question is, of course, we cannot speak on behalf of IDF. What we do know, that the staff is detained, that the staff is a part of the WHO workforce and part of the UN and must be urgently released. We are extremely concerned for his well-being. Over to you.
Yeah.
Dr. Tedros, please.
Yeah, thank you. So we, through our office, local office, we have asked for the release of our colleague. I will also write to the foreign minister and escalate it to ask for the immediate release of our colleague. But we have already asked at the local, through our local office. If there is no progress, then my plan is to ask at the highest level possible. Then on the details of the person, of course, initially 4 people were detained and 3 were released and 1 is still in detention. So I just would like to clarify, but we prefer not to go into details about our colleague who is in detention. Then the other is on mass starvation. And the statement, I think, today from some organizations. As you know, mass starvation means starvation of a large proportion of a population. And a large proportion of a population of Gaza is starving. I don't know what you would call it other than mass starvation. And it's man-made. And that's very clear. And this is because of blockade. And I have said it in my statement, more than 80 days of blockade straight. And then, of course, there is opening now, but it's not enough. It's just a trickle, and people are starving. Imagine 1,026 people have died while trying to feed themselves. If they're not starving, imagine risking their lives. I don't know why we're even splitting hairs here. And not only 1,026 were killed while trying to feed themselves or find food for their family, thousands were also wounded. So if you put that, there is mass starvation. Large proportion of the Gazan people are starving. And we demand that there is full access. And we demand that there is a ceasefire. We demand that there is a political solution to this problem, a lasting solution. And we also demand the release of the hostages, as we have always said. Peace is the best medicine. Thank you.
Thank you, Dr. Tedros and Dr. Peperkorn. I think we have time for one last question. We have Carmen Pound from Politico. Carmen.
Thank you so much, Tariq. I just wanted to go back on the IHR regulations that Dr. Tedros spoke at the top about. And I was wondering if there's been any more outreach or communication with the US administration about that particular issue, besides them saying they're not going to adopt the changes to the regulation, and cooperation with the WHO in general, at the higher level, not the technical level. Thank you.
Thank you, Carmen. Maybe Mrs. Steve Solomon can take this one.
Thank you for the question. Maybe I can provide some context to help with answering that question. So in May 2024, the World Health Assembly, the WHO, adopted amendments to the International Health Regulations, the IHRs. These amendments will strengthen cooperation among countries when global health emergencies arise. That adoption by the World Health Assembly opened the door for a period of consideration by each country domestically. It's a step-by-step process. Countries consider it together at the World Health Assembly and then individually as a national matter, and this ensures fidelity to the principle of national sovereignty. The deadline for countries rejecting these amendments, which were adopted at the Health Assembly last year, the deadline was July 19th. That's last Saturday. That deadline has now passed, and it's now clear that the 2024 IHR amendments will apply to the overwhelming majority of the 196 countries that are party to the IHRs. All the specifics will be released soon, but at this time we can say that in addition to the US, and this is the question you raised, in addition to the US, which made public its rejection of the IHR amendments, less than a handful of others have substantively rejected them. So again, the 2024 amendments will apply to the overwhelming majority of all countries in the world. In sum, the status of the IHRs as a nearly universal instrument to help countries prevent the international spread of disease remains strong. Thank you.
Thank you very much, Mr. Solomon. This will bring us to the end of this press briefing. Journalists will get, as always, opening remarks that were made by Dr. Tedros, as well as the audio and video file of the briefing. With this, I give the floor to Dr. Tedros for his closing remarks.
Thank you, Tariq. Finally, this Friday, the 25th of July is World Drowning Prevention Day. And every year, hundreds of thousands of lives are lost to drowning. Most of these are preventable deaths, often of children and young people in low and middle-income countries. WHO is working around the world to support countries, communities, and parents to take low-cost, evidence-based measures to save lives and protect future generations. And finally, thank you to members of the press for joining us today, and see you next time. Thank you.